So the thing that attracted us to Novion was the research base. There's over 7 years worth of research done on the product already, and for us that was key and critical, particularly because we're always striving towards clinical excellence. And I think in the States they've published 94% success rate, which in the UK it's been around 84%. But for fungal nails, that's quite a high efficacy, and it's quite safe.
There are a few clinical problems that are just really difficult to get rid of, and a big one of those is fungal infection in nails. So we've got patients who've been coming for years and years and years. You grind the nail down and they've tried many different things, topical things, tablets, and can never seem to get rid of it. So having something like this that we can say, you know, there's the research out there to show that it's really effective against these problems is great. Just to have something like this that we can offer patients.
When I've treated patients with Novion, the consultations have gone quite well. It's a fairly relaxed, though mildly lengthy process. There is very little discomfort, little bit of heat experienced by the patient, and the whole experience for both myself and the patient seems to go very well. The outcomes also seem to be looking very good so far.
On average, we would see between 10 and 15 patients a week with fungal nail infections of varying degrees that could be treated with this system. People within our clinic with fungal nail infections have generally tried lots of other products such as tea tree oil, or even people using homeopathic remedies, or even people use vinegar and the likes, to everybody using well-established oral medications. However, there's a big proportion of people can't actually use their medications or choose not to because of the health risks, etc. Whereas this offers a good scientific base, evidence-based treatment that has a high efficacy rate, and so it just offers people the reassurance that it's going to potentially have a good outcome for them.
We know with fungal infections, the sooner you can treat it, the easier it is to treat. But we get patients through who've tried everything and nothing's worked. And to have something like this, where you've got a really good chance, 80% chance of it working, is probably something you'd want to invest in after trying all these different treatments that don't really do much. The fungus that causes athlete's foot is really easy to treat, but it's really difficult to treat once it gets into nails, and it can easily spread from one nail to another, or even to a partner's if they're using similar things to wash their feet with, or nail nippers, that type of thing.
It's essential that patients follow a good home hygiene regimen as well to maximise the effects of the Novion treatment to prevent reinfection. So we need them to follow, clean all socks. We need to use the Lamisil preparations, Lamisil spray, etc., or powders within their footwear. And obviously it's important that they wash towels and bath mats as well to prevent cross-infection to their other family members as well. And if they do follow that regimen, it's going to improve the whole clinical outcome.
Whilst fungal nail infections aren't painful, nobody ever dies from them, they are really embarrassing, to get your feet out, especially in the summer when they're horrible, thick brown and everybody can see them. That's why some people don't take their shoes off. To have them treated on the NHS, you can't, apart from having them ground down possibly if things are very thick. But to have something that gives you confidence that you will have an impact on it is something possibly people would want to invest in, and that's what this is.
Within our business, we have lots of other technology such as our Motion Metrics 3D running analysis, our musculoskeletal lasers and our in-shoe pressure analysis equipment, all of these technologies are essential to improve patient outcome. We don't have technology for technology's sake, and this piece of equipment is another one of those, one of that type of equipment that's actually going to be a much benefit to improve patient outcome.